Hi guys, it's Pearl, your canine physiotherapist here. Today I'm introducing a beautiful dog called Bentley, and he had surgery a few months ago for a problem called elbow dysplasia, which is where there's an ill-fitting joint and the surgeons need to go in and tidy things up so that the joint can work more congruently and the dog can function well. Bentley's owner was having trouble after she'd been signed off by the surgeons, where she was told she could do more exercise with him, but every time she upped his exercise, he presented with a lameness on his post-op leg. So it was a really frustrating time for them, and when they came to the centre, I did an assessment and I found some muscle wastage in the muscles in Bentley's chest and around the shoulder and elbow on his post-op leg. So it's not surprising for me that there was lameness that would flare up every time he got more active on the leg. And so I designed a program to help him recover some of his muscle mass that he had lost due to his condition, the elbow dysplasia. And I designed a program around increasing his strength and muscle mass to support his joint. Ultimately, we're trying to achieve pain-free movement so that he can get back to living his best life. So here's a few exercise ideas for you guys at home, and I hope you find them helpful.
Get your dog to place their front legs on a raised non-slip platform. The rear legs should be in a square standing position. Ask for a paw shake and hold your dog's leg for 5 seconds at a time. Pay attention to how difficult it is to pick up each paw and if your dog can remain balanced. When a leg is lifted, your dog should shift their weight appropriately to balance on 3 legs without repositioning any of their paws. There should be no excessive foot movement, and the dog should not lose their balance. Bentley had surgery on his left elbow, and we can see clearly when he goes to lift that leg, he loses his balance. So he needs to practice this exercise to gain more strength around his shoulder and elbow. This will re-establish balance and symmetry in his muscles after his operation. Without specific rehab, Bentley would continue through life and be at risk of injury due to muscle weakness and asymmetry. I have also recommended a lower leg lift, which would be easier for Bentley to work with on his post-op leg. Aim for 5 repetitions with a 5-second hold on the weaker side, and you can gradually build up your holds and reps as strength improves. With the front paws up, lure your dog's nose to one side. The idea is to shift the dog's weight by bringing their head to one side while they maintain a square stand position with their front legs. We want to see a subtle weight shift before returning your dog's head to the neutral starting position. Your dog should keep their front feet still throughout 5 repetitions of this exercise on both sides. We always aim for correct form over quantity of repetitions, especially as your dog is starting to learn these new movements. With the front paws up and dog's rear legs in square standing, spread an open hand over your dog's shoulder blade. Gently and slowly shift the weight from one side to the other. The aim is not to push your dog over. Their paws should remain in the same place throughout the exercise. Aim for 5-second holds and 3 repetitions on the weak shoulder when starting out with this exercise. Stepping away from your hand often indicates weakness, so you might need to adjust your pressure, especially on the weaker side. In this video, we can clearly see Bentley's left elbow winging away from the body on his post-op leg. This needs to be strengthened via regular rehab practice to protect his joint health long term and keep him moving pain-free into his senior years. Also, we can see him sidestepping away, which further indicates weakness, so there is lots to improve with this exercise to help Bentley after his operation. With front paws up, lure your dog's nose down towards the platform. The dog should reach low enough to get their elbow joints to bend. They need to keep all 4 paws in place and remain balanced throughout the exercise. Let the dog return to neutral between each repetition. As the dog pushes back up into standing, they are having to recruit the tricep muscle group. Aim for 5 repetitions at a time as your dog learns the new exercise. Bentley chooses to offload his post-op leg, which means he is favouring his non-surgical leg. This is a pattern of dysfunction we need to break, or else he is going to be prone to injury. So I recommended keeping the lure slightly to the left to encourage more weight bearing on the post-op leg. Ideally, we want Bentley's front legs to stay in line with each other throughout the exercise and for him to evenly work both front legs. You can see he is quick to reposition his post-op leg between reps. This will improve with practice. Remember, the aim is for both front legs to stay in line with each other and no repositioning of limbs during the sets.
Thank you for watching this video. Please like and subscribe if you wish to see some more.